Here we will be discussing the next part, autism in younger children. Every category has different symptoms and forms of indication. Young children, adult children, adults, males, females, everyone have different categories and different symptoms. So in young children, it is a different form of indication. You will see they will never respond to your calling of their names, or even if they do, very hardly you have to call them. So mostly when you are calling them in younger age, of the same age children, they will be responding to their name, but when you are calling their name, they will not be responding. Secondly, they will just the eye contact, they will avoid it. They will not be able to have a consistent eye contact with you. It's not like staring. They will hesitate continuously to have a eye contact with you. Then the next part is they will not be smiling back or giving you back the same gesture that you are giving to them. Means they will not be able to reciprocate the same emotional state with you. That reason is that you will not be able to understand what they are thinking or how will they respond, why they are taking the way things you are not responding to, because they are not having the sense developed to respond emotionally, either in a happy state or in a crying state. You are thinking they should smile because you are giving a smile to them, but they will not smile back. And you will be taking it in another sense because you are not aware of the knowledge. Then another symptoms is that they get upset if they have a different taste of smell or different sound that is irritating to them. They will get irritated with a very small change in a taste of their food, smell of their food, or even if a small sound, a change in sound decibels even, means a smaller increase in sound, a smaller lowering in sound will irritate them very badly. It can impact their mindset very badly. So we will think, what's happening with them? It should not be the case. They should not get irritated with this thing, with a small change in the taste, smell, or sound. But they will be. These are the indication in a child, in a younger child, that they have autism. So you should be consulting with a doctor if someone is having these symptoms at a younger age. The next symptoms, another symptom you can just rectify for them is that they will have repetitive hands and fingers movements. They will keep moving in a certain manner that is not normal in their age, or other people in a normal growth, they will not be doing those movements. So you will be able to resonate with their movements that this is not normal in a child's age of the same age. So you can see they will have flapping hand movements, consecutive hand movements, or facial expression in a repetitive way. So you can spot the symptoms, or you can spot that there is something that is not normal and they should be consulted with a specialist or doctor. Then there is another symptom that you can see: they talk less as compared to other children. They will be focused in their own life, own patterns, own games. They will not be communicating with other children or adults. So that's another major point. In fact, that is one of the major point that because when we started the definition of autism, the social behavior and communication development is not developed. That means when they're not communicating with you like other children's, so that means there is something to be worried about or to be consulted for with a specialist. This is one of the major symptoms that I'm requesting to look for in young children with autism. Then another point is they will start using the same words over and over and over again. You keep saying something, they will keep repeating the same words over back to you. In fact, once they start handling or get hold of a word, they will keep repeating the same word again and again and again. You will be getting irritated. Why is he or she repeating the same word again and again? Why that kid is not behaving normally? And in fact, you will be irritated. Why are you saying this again and again? But you should be taking care into this factor, taking care of account of this factor that they are not able to comprehend that it is normal or not of repeating the same word or not. It is instinctively coming back to their mouth again and again the same word. So you have to be able to understand, and then once you understand that, okay, this is the problem they are facing, it's not in their control and this is the way they are behaving, then that's the right time to consult to the specialist. Hopefully, you have learned the symptoms and signs of autism in young children. Thank you very much.